So I wanted to thank all of our speakers. We only have a few minutes. First of all, I'd like to, again, just voice my appreciation for the work that has been done, thinking about and utilizing communities and the strengths of communities in order to advance health equity. And I think something that kind of an idea that brings all of these different talks together is the notion of thinking of it in systemic ways, making sure that when we're thinking about how to engage communities or individuals or providers in digital strategies, to be aware that there are systems that underlie that, and that certain examples of ways that we can actually reach some of the smaller systems that are nested within these structural barriers. And some of the ways we can do that is through CBPR, and showing a couple examples of how effective that can be in not just engaging the communities, but sustaining health changes with that. So I don't know if there are any, we just have time for just one question, two. So I guess my one question, I was holding it off, if you could briefly address this, is thinking about sustaining change in communities. And so that, I know Jimena, you spoke a little bit about leveling the playing field so that when the researchers leave, the community still has had value for the experience. But I wonder if each one of you can think about and maybe give just a brief statement regarding how we can sustain the change in the communities in order to reduce these disparities. It's a loaded question, I know, but.
Well, I think that coming from a community-based organization, I might get some flack for saying this, but I think we have to hold our academic institutions accountable for sharing the resources and providing some of that capacity building in the communities, because certainly academic institutions really want to work with community partners, but I think that has to be done in an equal manner.
I guess I'll just add a piece. I think that it comes down to a lot of the paying attention to what, to build on that. I unquestionably support that. But I also think it's about paying attention to what is adding real value and really asking that bigger question, but what is the technology meant to do? And watching what people derive real value from. And often this may not be what we designed it for, but if people are and this is where being connected to the community really helps, because they may say, well, we're actually using this technology in a way that you hadn't planned, but it's adding a lot of value to our everyday life. And that's something that we want to work around and build off of, because I think it's always tough, particularly with audiences like this, that health is what we live for, it's what we study, it's that, but for a lot of us, we only think about it when we don't have it. And so how does it fit within the fabric of everyday life and everyday communities, these technologies, so it's not just an add-on? Because I think once it becomes an add-on, it becomes less sustainable, because then we may find another add-on somewhere else and there's no competition for our time and attention.
And I would just like to add that when we talk about this type of partnership, it's really two cultures coming together, regardless of your personal culture. If you're in academia, this is your culture. And if you're in the community or not-for-profit, that is your culture. There needs to be a lot of communication about expectations. So one thing that happens in the culture of academia is that we move from a project to project. And this is very inconsistent with cultures of communities, but where they want to see a continuation and trust building. I think we, people in the academia, need to be very minded. So there are a lot of names for that in CBPI research, like helicopter research, et cetera. You come and you live, and we need to stop doing that. But we also need the support of policy support and institutional support to be able to do that and to be able to remain with the communities even after the funding is gone.
Jose?
I guess I come at a different angle. I think about the user, right? So in public health, in the context of HIV, we want young men who have sex with men to get tested, right? And all the campaigns you'll hear is go get your test, but nobody has stopped to ask, well, what is it like for a young man to go get tested in these settings, right? And so we're building this technology to motivate their change as if they're living in an environment where quality control can be assured and their privacy and confidentiality can also be placed. So, I resonate with everything that's being said about community partnerships and academic partnerships, but I think also trust and respect of the users themselves and making sure that they're also making decisions is vital.
Thank you. I'd like to invite Karen Anderson to come up, and once again,